Have you ever wondered if your body could be trying to tell you something serious? We often brush off symptoms, thinking they're minor, but what if they're signs of something more dangerous, like cancer? Today, we're diving deep into early warning signs that your body might be growing cancerous cells. Pay attention, because spotting these early could save your life. In today's video, we'll be talking about the signs and symptoms of cancer that you should never ignore. Early detection is key, and knowing these signs can make all the difference in catching cancer before it progresses. Stick around as we discuss symptoms backed by scientific studies and what to do if you spot them. Signs like unexplained weight loss, fatigue, and persistent pain that may indicate cancer. The most common early warning signs across various types of cancers. How to listen to your body and act on these symptoms before it's too late. Let's get started. Number 1. Losing weight without trying is often seen as a good thing, but when it happens without any changes to your diet or exercise routine, it could be a red flag. In fact, according to the American Cancer Society, unexplained weight loss of 4-5 kilograms or more can be the first noticeable sign of cancers such as pancreatic, lung, or stomach cancer. A study published in the British Medical Journal found that unintended weight loss was associated with an increased risk of certain cancers, making it a critical symptom that should be addressed immediately. Number 2. Persistent fatigue. Do you find yourself feeling tired all the time, no matter how much sleep you get? While we all get tired from time to time, persistent fatigue, especially if it's debilitating, could be a sign of leukemia or cancers such as colon cancer. Cancer drains your body of energy by diverting your resources to fight off the disease, leaving you feeling exhausted. A 2015 study published in The Lancet reported that cancer-related fatigue is one of the most commonly experienced symptoms by cancer patients, often appearing early in the disease. Number 3. Chronic pain. If you're experiencing chronic pain in areas like your bones, back, or head, it might be more than just a lingering ache. Persistent pain that doesn't go away or gets worse over time can be a symptom of cancer spreading. Bone pain is especially linked to cancers such as bone cancer, and back pain is often a warning sign for kidney or spinal cancers. Pain doesn't always indicate cancer, but any persistent pain that doesn't have a clear cause should be checked out by a doctor. Number 4. Another early sign that cancer may be developing is changes in your skin. This doesn't just refer to moles or lumps that could indicate melanoma. Other changes, such as yellowing skin, darkened skin, or even redness or itching, can point to cancers such as liver cancer, kidney cancer, or even blood cancers like leukemia. According to the Skin Cancer Foundation, changes in the skin are often the first visible sign of various types of cancer. They suggest frequent self-checks and seeing a dermatologist if you notice something unusual. Number 5. Changes in bowel or bladder habits. Persistent changes in your bowel or bladder habits could be a sign of colorectal, bladder, or prostate cancers. Blood in your stool or urine, chronic constipation or diarrhea, and frequent urination should never be ignored. A study published in Gastroenterology found that early changes in bowel habits were highly indicative of colon and rectal cancers, especially in individuals over 50. Let me share a personal story that might resonate with you. A close family friend, Jane, ignored symptoms like fatigue and occasional blood in her stool for months. She thought it was just stress or a minor issue. By the time she got checked, she was diagnosed with stage 3 colon cancer. While her treatment is ongoing, she often says, "I wish I had listened to my body sooner." This story is why it's so important to recognize these early signs and get medical attention as soon as possible. If you or someone you know is experiencing any of the symptoms we've discussed, here are some practical steps you can take right now. Schedule checkup. Don't wait. Early detection saves lives. Schedule a visit with your doctor and discuss your concerns. Monitor your body. Keep a symptom diary if you notice any unexplained changes in your body. Track things like fatigue, pain, and weight loss over time. Get screened. For certain cancers like breast, cervical, and colon cancer, regular screenings can catch issues early before they become serious. These steps could mean the difference between catching cancer early and dealing with it at a more advanced stage. What if I have 1 or 2 symptoms, but they aren't getting worse? Even if symptoms seem mild, it's always better to get checked early. Many cancers develop slowly, and early detection makes treatment more effective. Are these symptoms always cancer-related? Not necessarily. Many of these signs could be caused by other health issues, but it's important to rule out cancer early on. Question: how often should I be checking my body for symptoms? It's a good idea to stay in tune with your body at all times. Monthly self-checks for things like skin changes or lumps, and regular screenings based on your age and risk factors are recommended. Have you experienced any of these symptoms, or do you know someone who has? Drop a comment below, and let's have a conversation. Don't forget to give this video a thumbs up if you found it helpful and subscribe for more important health updates. And remember, if you're noticing any of these signs, don't ignore them, schedule a checkup today. To recap, today we talked about key signs that cancer could be growing in your body, including unexplained weight loss, chronic fatigue, persistent pain, and changes in your skin and bowel habits. By listening to your body and acting early, you can significantly improve your chances of catching cancer before it progresses. Next week, we'll be discussing more ways to stay proactive with your health, so make sure to hit that notification bell to stay updated.